today is how to examine the cardiovascular system. Also, we started with inspection. Inspection of the cardiovascular system, shape of the chest, just the same as in the respiratory system, shape of the chest,
Type of breathing
and the
pulsations.
cardiac impulse, and three, the extra cardiac signs. The shape of the chest in this patient is what?
Normal.
Slightly normal or normal. Okay. The cardiac impulse, we look for apex beat. This is the area of apex beat. This is the area of apex beat بالفifth then within the mid-clavicular line. Okay. If it is displaced, we look for it. قطع النفس. يشوفوه؟ يعني ما نشوف. إذا ما شفنا, if we couldn't see, we look down in the axilla. If not seen, we look in this area, and then we look on the right side. Probably the patient, he got dextrocardia. Then the other cardiac impulse, epigastric pulsation. قطع النفس. There is epigastric pulsation. Epigastric pulsation, if it has happened, the main cause هو hyperdynamic circulation. And if it's cardiac lesion, tricuspid incompetence,
Aortic abdominal aneurysm.
any disease will right side, it might cause epigastric pulsation. Suprasternal pulsation, this is the sternum, and this is pulsation بتاع النفس. There is light pulsation. Also, the main cause هو hyperdynamic circulation, where there are two causes for suprasternal pulsation. هما aortic aneurysm unfolded aorta due to severe hypertension. Then we look for the carotid pulsation. Look for the carotid pulsation. We look for the JVP pulsation. These are the impulses, like carotid pulsation, cardiac pulsation. Then the third one is extra thoracic signs. We look for a clubbing. We look for cyanosis, peripheral or central. Peripheral or central cyanosis. We look for ankle edema. We look for splinter hemorrhage. We look for rote spot. All these signs, nearly 11 or 10 signs extra thoracic. This is what inspection of the cardiovascular system. أول شيء تحكي عن الشيب. Then the cardiac impulse اللي هي epic beat, epigastric pulsation, suprasternal pulsation, carotid pulsation, and JVB, where three is here extra thoracic signs. The second part of the cardiovascular examination is its palpation. Palpation, it composed of 6 points, 3 in the chest, with 3 outside the chest. The 3 in the chest is the palpation of the apex beat. This is the area of apex beat. We put our hand in this shape. Yes, there is a slight pulsation here. It is normal. Yeah. And when we feel the pulsation of the apex beat, we put our finger on the top of the pulsation. If the pulsation doesn't move my finger and it is localized, therefore it is normal. First, we palpate it. Secondly, doesn't move my finger. 3, it is localized, not diffuse, therefore it is normal apex beat. If the apex beat is pushing my finger this way, this is, we call it thrusting, forceful, heaving sometime, and some students, they say that it is strong. It is not strong and weak. Thrusting, heaving, or thrusting or heaving is better than the strong. And if it move my finger, we should localize the epic speed, whether it is displaced or not displaced. Displaced epic speed, it's usually in the fifth intercostal space, mid-clavicular line. If it is displaced, it means more than 10 centimeters from the mid-sternum. Okay? Therefore, if it push my finger this way, and it is away from the mid-sternum, displaced, it is called volume overload. More fluid. The patient most probably have an aortic incompetence or mitral incompetence. If the epic speed is within the mid-clavicular line, but it push my finger, thrusting, it is pressure overload. Either the patient got aortic stenosis or severe hypertension. The third epic speed is an epic speed where when it doesn't push my finger and it is diffused, not pinpoint by single finger, it is diffused, but it doesn't push my finger. This is usually called tapping epic speed. Epic speed formed by the left ventricle apex. Two epic speed formed by left ventricle, and one epic speed formed by right ventricle. The tapping is formed by the right ventricle, while the normal and the heaving is formed by the left ventricle. This is the epic speed. Epic speed is lowermost, outermost cardiac impulse. If you find two epic speed, take the lower. If you find two epic speed, take the outer. Okay? To localize. Therefore, we have three things in the chest on palpation. First of all, what? Epic speed. The second one is cardiac thrill. In the apex, in the sternum, over the sternum, on the base of the heart. And we put our finger on the carotid to localize the thrill, whether it is systolic or diastolic. The third thing you should look in palpation of the cardiovascular is the parasternal heave. This is the sternum, and this is parasternum. In this way, in this area, put it there and slightly push it. Heave. It means push your hand by the heart. This is usually seen in right ventricular hypertrophy, pulmonary hypertension, pulmonary stenosis, etc. While tapping epic speed seen in mitral stenosis, pulmonary hypertension to ASD even can cause tapping epic speed. Therefore, three part of palpation on the precordium, in the chest, and the other three in the where outside the chest. First of all, the pulse. This is the way to examine the pulse. Put your left hand on the cubital fossa and the other hand on radial. This is the radial artery and this is the ulnar artery, both on supplying what the hand and making an arch in between. Okay, you can palpate both sides. We look for three things mainly: the rate, whether it is tachycardia, whether it is normal or bradycardia. Normally 60 to 100. Above 100 tachycardia, below 60 is a bradycardia. And we look for the volume, whether it is normal, small volume in heart failure, in constrictive pericarditis, heart failure, small volume, in hypothyroidism, small volume, whether it is large volume collapsing or non-collapsing. The non-collapsing is hyperdynamic circulation, anemia, thyrotoxicosis, exercise, fever, pregnancy, all causes large volume pulse. While collapsing pulse is caused by what? Aortic incompetence and severe anemia. Okay? And this is the way to do collapsing. Okay? Therefore, the pulse, this is the pulse. It is a large volume pulse, non-collapsing pulse. Two things we look in the feet as a part of palpation of the cardiovascular system. We said there are 6 things you should palpate in the cardiovascular system. 3 in the heart, apex beat, thrill, and parasternal heave. 3 outside the heart, the pulse, the peripheral pulsation. This is the peripheral pulsation. This is dorsalis pedis. This is dorsalis pedis. Large volume. خليه تشتعي هنا. خليه ديش هنا. خليه هنا. مو هنا. يجي. اوكي. حسيتي له ولا؟ العين الثانية وينها؟ Okay, bilateral. Then, if this disappear, we look for anterior tibial or posterior tibial. If it's lost or not palpable, we look for what? This is what? Popliteal. 2 finger and push it up to palpate the popliteal. If it is lost or not palpable, we look for the femoral. This is the way of looking the femoral. And if it is lost, we look for the external iliac. We go above the ligament and we push our finger down. If it is not palpable, we look for we couldn't palpate the internal iliac. We look for aorta. This is the way for examination of the aorta. Above the umbilicus to the left. We push our finger down, down, down until we feel pulsation of the aorta. Then we move it left and right, up and down. Why?
Lymph node?
Yes, for the para-aortic lymph node. This is the way to palpate the cardiovascular system. Three things in the heart, in the precordium, the apex beat, the thrill, systolic or diastolic, and parasternal heave here, and the 3 things outside. This is the pulse, rate, volume mainly, whether it is regular or irregular. Okay, and then the peripheral pulsation. I show you how to examine the peripheral pulsation: dorsalis pedis, posterior tibial, anterior tibial, popliteal, femoral, external iliac, then the aorta. And ankle edema. We look for ankle edema. That's 3 parts in the cardiovascular system. Okay. Now we come to the percussion of the heart. There are only 2 indications to percuss the heart. No third. It is only 2.
Cardiac effusion.
Cardial effusion and chronic obstructive airway disease, where we get diminished cardiac dumbness chronic obstructive because hyperinflated chest. This is the usual size of the heart. It is your fist is the heart size. Yes. This is the base of the heart. This is, and this is the upper part of the heart. Okay, this is the apex. The distance between mid-sternum till apex usually 8 centimeters, not more than 10. Above 10, it is displaced. Okay, displaced to the axilla. This is the size of the heart. Percussion of the heart. We starting this way from the left. We put mark there. حتى يبقى الصبر. This is gas, my stomach. This is the heart, and then we come from the axilla. Tympanic, 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 dull, slightly dull. This is area of the heart. If it is displaced, it means reaching this area. Usually displaced by what? Pericardial effusion. Percussion of the heart become more dull and displaced. This is the indication of percussion of the heart. Two indication, not more. Chronic obstructive airway disease and asthma, usually dullness diminished, no dullness. And pericardial effusion, dullness what? Is enlarged. Auscultation of the heart. This is the stethoscope. This is the diaphragm, and this is the bell. Bell. There is leather or plastic material over it, just to make sure touching, to isolate the environment outside from your ear, and also let you make no cold, because this is in cold weather is cold. It irritates the patient. Diaphragm. اعطيني ورقة وقلم خلنا نكتبها بالدفتر. Diaphragm. اعطيني ورقة كبيرة حتى. Stethoscope. Diaphragm. It composed of D, and D usually is 1 plus what? 2. Okay, making D. Therefore, it is the first heart sound, the second heart sound, early, diastolic, murmur of the what? Aortic incompetence.
السلام عليكم أستاذ.
Sound. Okay. The bell. And because the diaphragm having H in the diaphragm, it is for high pitch. High pitch sound. While the bell is B, it composed of 1 plus what? 3. Therefore, third heart sound, fourth heart sound, mid diastolic, murmur of mitral stenosis, all respiratory sound. Because there is L in the bell, it means low pitch sound. كتبتها؟ صورتها؟ نعم. يلا. First of all, we put the stethoscope over the mitral area. Then we put our thumb on the carotid artery. You will hear loop dub, loop dub, loop. It is the first, and dub is the second, and in between the systole and after the second is diastole. Okay, loop dub. يلا حطوا السماعة حصول. حطي لك الإبهام مالتك الأيسر على الكاروتيد. الإبهام وهذا إبهام. لبدو لبدو. اوكي. هذه حسيتي لازم تحسي. لبدو. If it is ter, not lubdub, it is ter. It means 3. And usually tachycardia, the patient goes ter. This is why I call it gallop. It is summation. Or either it gallop is the fourth heart sound or the third heart sound. Usually the third heart sound with ill patient, usually. It means heart failure. And the fourth heart sound usually with diastolic dysfunction, hypertension. Normally the third heart sound is seen in the pregnancy and children. Between the first and the second, if there is murmur, then we look for the sound, whether it is first, second, whether extra sound, 3 and 4th, and we look for the murmur between the first and the second systolic. And usually the systolic is just like this. In Arabic called nafakh. Usually long, but sometimes systole is short, especially innocent systole, benign systole. You will see it in kids. While diastole is usually short. I mean, usually, mostly short, just like this. In Arabic, we call it shafat. And then systole is what? Nafakh. While diastolic murmur is what? Early diastolic murmur of aortic incompetence. Okay? Mid diastolic rumbling of mitral stenosis. Short, mid diastolic. With a pre-systolic accentuation sometimes. And then inspection, palpation, we talk, percussion and auscultation. Adding things, some other things, the way call it, what they call it this?
Fracture.
Yes, fracture rub, اللي هي يصير بالبريكاردايتس. رب بالسيستولي. Any question? This is how to examine the cardiovascular system. Inspection 3. Shape of the heart, Cardia Compass, extrathoracic signs. Palpation 6. 3 in the heart. Apex beat, thrill. We look for a thrill and we look for parasternal heave. And the 3 outside the heart. Pulse, peripheral pulsation, or ankle edema. While percussion, there are 2 indications for percussion: pericardial effusion and COPD, obstructive airway disease, hyperinflated chest. You will see no cardiac dumbness. Auscultation, we look for the sound, the first, the second, and the third, and the fourth, and we look for the murmur in between them, and we look sometime for a click. Click. What is a click?
Aortic dissection.
Usually the heart is having valve. Closure of the valve, mitral valve, when it open for the diastole, when it close the first heart sound. Close. We hear it. Even by our ear, by stethoscope. But the opening of the valve, it also causing sound. We couldn't hear it by stethoscope. This sound is not normally heard. If it is heard, this is called the click. Okay? The opening of the valve. If you hear it by stethoscope, this is the click. While the first has sounds, the closure of the valve, mitral and tricuspid being closed, causing the first heart sound. Aortic and pulmonary being closed, causing the second heart sound. Loop, dop, loop, dop, loop, dop. While the click is the opening of the valve for systole, which is normally no sound. I mean, there is a sound, but we couldn't hear it. If we hear it, it's augmented, it'll become hearable. This is called click. And the click either systolic or diastolic too. It is the opening of the valve, not the closure. Click is the opening of the valve. Therefore, opening the snap is what? Is a click. Because you hear it on the opening of the valve. Opening, snap. Therefore, it is a click. Any question?
No.
Okay.